I'm Matt Willis, Public Health Officer from Marin County, with an update on the onset of the local respiratory virus season. We've been closely monitoring activity for COVID, RSV, and influenza in wastewater and clinical settings. This offers us a kind of early warning system, and this week, for the first time, we're seeing upticks in all three viruses in Marin. As we navigate this season, it's important to stay informed and to take action to protect ourselves and those around us. Starting with COVID, today, the Marin County COVID-19 level was upgraded from low to medium based on increasing amounts of virus in our wastewater. After 9 weeks at low levels, we're seeing virus levels increase in all 6 Marin sampling regions at the same time. This means we're all at greater risk of exposure when we're out and about in our community. The approaching holidays typically fuel even more transmission. The single most important measure to prevent serious illness and disruptions to school, work, and holiday plans is vaccination with the new fall vaccine. Our vaccine uptake data is a mixed picture for COVID-19. The good news, as of today, is we have among the highest rates in the state for residents over age 50. That will reduce local hospitalization burden and mortality. The bad news is that over a month into the availability of the new vaccine, only about a quarter of our older residents have gotten it, which says a lot about how low rates are elsewhere. We're also seeing that with the national plan to commercialize the vaccine, where it's not offered for free to everyone through government public health channels anymore, the gaps between our lower and higher income residents are bigger than ever. To help close that gap, we've invited our long-term partners from Safeway to host pop-up vaccine clinics within our most vulnerable communities. As a commercial pharmacy, Safeway has access to vaccine that we in public health have now lost. And we're fortunate they're willing to step out of the pharmacy and travel with us into communities who need it most. During the pandemic, we learned very clearly how important it is to bring vaccines to people if we're trying to strive for vaccine equity. The message for all residents is now is a time to get the new 2023 fall COVID-19 vaccine. Your healthcare provider, local pharmacies, and public health are working to ensure everyone has access to this critical tool. Now to RSV. RSV is another potentially serious viral respiratory infection, especially in infants and older residents. RSV activity has been rising steadily through October, and it's exciting to see that this is the first year that RSV is preventable with a vaccine. All residents over age 60, people with certain medical conditions, and people who are pregnant should be vaccinated. For expecting moms, this is especially important now because of a serious national shortage of the new RSV infant immunization. There's plenty of adult vaccine, and the protection you get from the vaccine is passed on to your baby before they're born. So for moms, your antibodies literally guard them against serious disease as infants. Now for influenza. We're seeing increases in influenza level in wastewater and among our rising case rates. The annual flu vaccine is highly protective. Even if you're infected with flu, vaccination reduces length and severity of symptoms, just like the COVID vaccine. Remember, prior to the pandemic, winter viruses have always given the healthcare system a hard time. Every year, flu causes an average of 35,000 deaths in the US, and RSV an additional 10,000 or so deaths. Now, with COVID, those stressors are compounded. On November 1st, the local mask requirement for Marin hospitals and skilled nursing facilities went into place. This is good timing because masks protect against COVID, RSV, and flu. For those who are at increased risk for serious illness, we recommend wearing a mask when you're in indoor public settings anywhere in the community. So to summarize, the respiratory virus season has begun in Marin with simultaneous increases in COVID, RSV, and flu. This was expected, and we know it's here. This is the first fall where vaccines are available against all three of these diseases. Of the many tools to protect against illness, vaccinations are the most powerful because they strengthen our body's ability to fight off illness, even if we're exposed and infected. And we should all expect that we will be exposed over the coming weeks to one or all of these viruses. Masks protect against infection also from all three of these diseases. Marin Public Health, your healthcare provider, and local pharmacies are adapting to a shift in the national COVID vaccine system into a commercial marketplace and are working to remove new barriers to access. We'll continue to provide updates on winter virus activity in our weekly communications and on our website. Together, we'll navigate this virus season the way we handled the pandemic, using science and a commitment to collective well-being. Thank you for doing your part.